Emergencies, attacks, disasters. Our world has changed dramatically. And because you never know what's just around the corner, more than a dozen American doctors and nurses travel to Israel to learn how to prepare.
I wanted to be trained by people that think about this all the time, who are always under the gun potential of terrorist attacks and have worked through all the scenarios and how to proceed. And if you want to learn something, you go to the experts.
The 5-day course consisted of drills, tours, and lectures by Israel's leading emergency responders.
All those people that took part in the program, and they all did it on a voluntary basis, no one got paid for it, truly understand the significance of, first of all, conveying and distributing their knowledge to others.
One of the highlights of the course was the chemical warfare exercise at the Israel Center for Medical Simulation. The scenario is this: the medical team had to suit up because they knew that the patient had chemical exposures and physical injury. You can see the physical injuries right here on his leg. Because the patient had secretions coming out of his nose and his mouth and his eyes, in fact he was vomiting, what they did was one of the first things was to grab this medication called atropine, and they injected it into him quickly because that's the medication that is going to counteract the chemical exposure.
Wearing all this stuff off of an ambulance, carrying them into your medical treatment area, the walking with the boots, it's much more difficult. We didn't do a lot of that, but as difficult it is with the gloves in the hands, it's also a lot more difficult to walk with these things because they're clumsy, they're klutzy. As you're pulling, the mask is kind of shifting around. You're trying to look down to get your footing.
Because we see a lot of it in the news. But it's totally different to do it, to see it, to use it, to feel it, to consider how do you talk to people when you have protective headgear on. It's difficult.
Through a unique mock drill, participants interviewed patients psychologically affected after being exposed to a disaster. They learned that invisible injuries are just as important as those that are obvious.
Most of us know already how to deal with the medical emergencies, how to deal with the acute trauma, and we trained on that earlier today, but the psychological emergencies really add up. In the military, we learned that the disease non-battle injuries, the non-battle injuries, really consume the most of your resources, and people who come in here with psychological and traumatic events need to be dealt with, and a simulation would really, really help a lot. It was very dramatic. I was very impressed. The actors were wonderful, and the people who come into your emergency room do consume a lot of your resources and a lot of your time, and can be very, very traumatic for them. Although they have no physical injuries, they are clearly injured, they are clearly damaged, and they need help. And so just because they don't have blood pouring out from someplace or they're a major injury doesn't mean they haven't been hurt by the terrorist attack.
The reality of the brutality of living in a disaster-prone area hit home when the group visited Sderot, a town frequently hit by Qassam, or missiles, originating in the Gaza Strip, where they heard from an IDF security officer and a paramedic with Magen Adom. Another powerful lesson was that no place is exempted from the cruelty of terrorism, so this protected playground of concrete was built, also in Sderot. And the world's largest underground hospital is currently in development at Rambam in Haifa.
We are now in a 20,000 square meter each floor parking lot. The parking lot is 60,000 square meters. 2 floors of it are also an emergency protected hospital against chemical and conventional weapons. The parking lot is 14 meters deep from the surface and 7 meters of it under the sea level. In this area, when we are now, we can see that the parking lot can be also an emergency hospital. Each cubic like this contained 8 beds.
The week wasn't all work and no play. Sights and sounds of Tel Aviv, Jerusalem, and Haifa were woven into the course.
The old Jerusalem and into the old city was very interesting. Going to the Western Wall was exciting. And praying at the Western Wall was fascinating and memorable. Did a little prayer to for my family to be healthy, for my wife to be healthy, for my grandkids and to do prosperous, and my patients to heal, things like that.
Israel is the, in my view, preeminent expert in disaster medicine. And I owe a lot of my career and what I do now in preparing New York City for pediatric disasters from what I learned in Israel. And each time we have a course, we learn more and more and get more expertise. It's not just about coming here and supporting Israel, it supports the United States. For an example, the Boston bombing, Boston Marathon, there were 3 people killed on the scene. There were over 200 people injured, and all of them made it, which is incredible. And I listened to the head of Boston EMS say that approximately 3 years ago, the Israelis were in Boston and taught us new techniques about rapid hemorrhage control and just worrying about airways and getting the patients immediately to the hospital and then to the OR, and that was confirmed by the leaders in the major hospitals in Boston. So Israel, again, contributed their expertise and saved many lives across the ocean with America.
5 days later, at a graduation ceremony at Latrun Commemoration Site, participants all agreed that they were going home better prepared for disasters.
I won't likely use this in a hospital setting, but I could see all the needed areas around how leading up to it and all the teamwork that's needed together. And so for me, getting the bigger picture of how we could be helpful in many layers, not just one layer, was very helpful. So I think it can be helpful on many layers.
The Disaster and Emergency Preparedness course of the American Physicians and Friends of Medicine in Israel will continue to evolve, training medical professionals on how to take the best care of people in the worst of circumstances. As Dr. Blumenfeld said, we don't choose the curriculum, it chooses us based on what's happening in the world. Dr. Mona Kana, Haifa, Israel.